Now we'll be discussing about hysterosalpingography, the most common method of tubal patency test. So it consists of three words, that is hystero means uterus, salpingo means fallopian tube, and gram is referred for X-ray. So hysterosalpingography, also called as uterosalpingography, is an X-ray examination of woman's uterus and fallopian tubes that uses a special form of X-ray in form of fluoroscopy and a contrast material. So, as I said earlier, it is the most commonly performed screening test for tubal patency. Advantages are we can determine the position of the tubal occlusion. One can differentiate between the unilateral patency and bilateral patency. One can assess the degree of damage to the tubal endothelium. And the peritubal adhesions can be assessed indirectly. And the uterine cavity can be made out with hysterosalpingograph, and it is relatively cheap and simple. So instruments used for hysterosalpingography include the ones which are used for visualization of the cervix, and that is the speculum, then the tenaculum forceps for holding the anterior lip of the cervix, uterine sound, Rubens oblique Leach-Wilkinson cannula. Rubens cannula we had seen when we were discussing about the dilatation and insufflation. This is the Leach-Wilkinson cannula. There is screw type of thing is there over here. Then the liver lock syringe of 20 ml. An oil-based or watery contrast medium is another thing which is required for hysterosalpingography. So hysterosalpingography, in this, the uterus and fallopian tubes are filled with the water-soluble contrast material. The radiologist is able to see its movement during hysteroscopy and assess its anatomy and function. So here we can see the Leach-Wilkinson cannula and the speculum, and this is a normal HSG. The uterus and the fallopian tubes are delineated, and the spill of the dye can be seen over here. So what are the indication of hysterosalpingography? It's for the assessment of infertility in cases of recurrent miscarriage, and the patency of the uterine tube in case of infertility, and the uterine and tubal lesions like tuberculosis, submucous fibroids and polyps can be evaluated. Then congenital abnormalities such as unicornuate, bicornuate uterus, septate uteri can be visualized. Pathology of uterus and uterine tubes can be determined by it, and it can be used post-tuboplasty and for tubal patency. Then the assessment of post-caesarean scar can be done with the HSG. It is used prior to artificial insemination and to confirm the diagnosis of secondary abdominal pregnancy. And what are the contraindications of hysterosalpingography? They can be absolute or relative. Absolute contraindications are possibility of pregnancy, history of acute pelvic inflammatory disease. Relative contraindications include history suggestive of pelvic inflammatory disease, recent uterine instrumentation like this thing DNC or dilatation of cervix, then the iodine allergy, active vaginal bleeding, and immediate pre-menstrual and post-menstrual phases. So for preparation, usually the injection, atropine and analgesics are given, and this procedure is done in the radiology department on X-ray table. So anesthesia is not required. The analgesics can be in the form of either diclofenac or one can use drotaverine for analgesia. So first is the visualization of the cervix, and anterior cervical lip is caught by the tenaculum forceps. Some people catch both the anterior and posterior lips of the cervix. And usually the timing of the HSG is from day 6 to day 10, and some advise it day 8 to day 12 of the menstrual cycle. So after confirming that the cannula can pass through the os, the syringe is filled with the dye. So earlier days it used to be the oil soluble contrast medium, and nowadays water soluble contrast medium is being used. There are advantages of both. Some advantages are there with oil soluble, some advantages are there for the water soluble. So advantages of oil soluble is that the uterine image is sharp and oil soluble, but ampullary rugae are this thing difficult to define in oil soluble, whereas it's easier to define in water soluble contrast medium. And its oil soluble medium is much more viscous, and absorption, it takes a lot of time in oil soluble medium, that is months, and in water soluble it is hours only. And however, the pain is minimal in case of oil soluble contrast medium, where it is significant in water soluble medium. Granular formation is rare in both, but it is very rare in water soluble medium. And rarely anaphylaxis can occur with the oil soluble medium, and embolism can occur, and no major sequelae are there with the water soluble medium. And pregnancy after HSG is much more in case of oil soluble medium, whereas there is no effect if we are using water soluble medium. So steps of the procedure. So in the cannula now, after the dye is filled in the syringe, cannula is fitted to that syringe, and all the air in the syringe and the cannula is completely expelled out. The cannula with the syringe is attached and introduced to the cervix into the uterine cavity. Slight pull is given on the tenaculum forceps towards oneself, while the cannula is gently pushed. So they are both in opposite direction. So there is avoiding of leakage of the dye from the cervix in the vagina. And thereafter, once the position is attained, the dye is slowly instilled into the uterus, and fluoroscopic pictures are taken. Fluoroscopy is done, or directly the X-ray picture films are taken. So some of the HSG findings we'll be seeing over here. One is the mucosal rugae. If they are present, like in the arrows which I was showing, they are favorable prognostic factor for subsequent pregnancy. If they are absent, then it means the severely damaged tubal epithelium. Then the periadnexal adhesions also can be delineated with HSG, as is seen over here. There is the irregular distribution of the loculated contrast medium around the fimbriated end of the tube. However, it's not reliable in evaluation of the peritubal adhesions. And this HSG picture shows the bilateral coronal block, and there is some extravasation of the dye. So there are certain disadvantages of hysterosalpingograph. That means pelvis, including the ovaries, is exposed to radiation when we are doing this procedure. There's a significant problem if the patient has had an early pregnancy accidentally. So abdominal pain, which peaks with 5 minutes after starting and usually settles down with the 30 minutes of the procedure. There can be intravasation, that is network of streak-like opacities adjacent to the uterine cavity that extend towards the pelvic side walls and subsequently migrate in a cephalic direction. As a false occlusion incidence is high, that's 12.5%, and even the incidence of false patency is quite high, which is 11%. So complications of HSG include peritoneal irritation and pelvic pain. There can be bleeding, which at times may be excessive. Vasovagal attack may occur with the HSG. Intravasation of the dye, which we had discussed earlier, within the venous or the lymphatic channels is especially common in tubercular endometritis. Then the allergic reaction can occur to the dye. Then the flaring up of pelvic infection can occur in 1 to 3% of the cases, and uterine perforation can occur rarely. Thank you.